Reflecting as a third-year medical student by Hameeda Y M Akoojee, Obstetrics and Neonatology, Part 3. Seeing as I have completed my Obs and Neo clinical rotation, today I would like to discuss each of the locations I visited and reflect upon what I have learned during the last 1.5 months. I visited 3 hospitals during the course of this rotation: Tembisa Provincial Tertiary Hospital, Kalafong Provincial Tertiary Hospital, and Steve Biko Academic Hospital. Tembisa Hospital's antenatal clinic, labor and postnatal wards seem to provide services to many more women than the other hospitals I visited, despite not being able to adequately accommodate all of these women. Resources were clearly lacking, and as such, women who visited the hospital were, in my opinion, not cared for optimally. There was a shortage of beds, and as such, women were made to sit on chairs not even 15 minutes after giving birth. They were also not followed up on regularly, nor were they given their babies despite said babies being perfectly healthy, their EBCA scores and examination findings reassuring. Mothers were made to fetch their infants from the nursery about an hour after delivery. These practices do not align with those of a baby-friendly hospital, which should help mothers to initiate breastfeeding within 30 minutes of birth. Privacy was not offered to these women, as there were only curtains between the beds, which were at times in tatters, this again resulting from the lack of resources. In postnatal wards, no such curtains existed. Privacy was also not emphasized upon. Women were seldomly covered by sheets during labor. Staff were friendly and patient with students, but did not practice respectful care, the principles of which I discussed in my previous video when it came to their patients. Many a time I witnessed nurses degrading and insulting women whilst they were in labor. This is not the way in which anyone, much less women who are experiencing one of the most traumatic moments in their lives, should be treated. Kalafong Hospital's level of care was much more assuring. Though staff had almost no time and patience for students, total indifference toward us, they focused this attention on the women in their care. Those in labor were reassured and encouraged throughout this stressful period. They were spoken to with respect, provided privacy, and made to feel as comfortable as possible. Babies were given to moms immediately after delivery, provided that they were healthy. I witnessed delighted mothers bond with their infants almost immediately after birth, a sight extremely heartwarming. Resources were much better allocated in this hospital. Each woman in labor was allocated a delivery room, which contained a single bed. In this way, as well as the way in which the nurses assured that a woman was always covered and the door kept shut when they were accompanying her, she was afforded her privacy. Kalafong Hospital encourages mothers to perform kangaroo mother care on all low birth weight infants, provided that they are stable. This practice was not observed in Tembisa. Steve Biko Academic Hospital, being a high-risk subspecialty hospital, only accommodates complicated high-risk individuals. Facilities are thus much more sophisticated. The hospital does, however, provide care to many more individuals compared to the 2 previously mentioned hospitals. The hospital has 2 massive obstetric wards, a labor ward, antenatal ward, and a neonatal ICU. There are also wards specifically dedicated to all manner of pediatric subspecialties, including cardiology, neurology, surgery, and orthopedics. Doctors and nurses are dedicated to their work and considerate of their patients. They are also always ready to teach students and receive their assistance. Despite their differences, all these hospitals' obstetric and neonatal units strive toward a common goal: the departure of a happy and healthy mom and baby from their facility. My medical skills. Before this rotation, I had 0 clinical experience. During its course, this module has afforded me the chance to apply much of the theory that I've learned and acquire skills that I will use often. These skills include essentials such as history taking, performing a general exam, blood pressure measurement, urine testing, and blood group and rhesus testing. Skills I have learned pertaining to obstetrics are the abdominal examination of a pregnant woman and examination of the placenta. Skills related to the neonate encompass the determination of EBCA scores, neonatal resuscitation, examination, determining the need for phototherapy in jaundiced infants, and the calculation of the Ballard score to estimate gestational age. This rotation has greatly enhanced my medical skills. After taking a thorough history, looking through a patient's file, conducting an exam, and doing appropriate side room investigations, I can now synthesize, by simple deduction, a list of possible causes, a differential diagnosis, something I could not have done without applying the knowledge I've learned in class as well as in the practical environment. I have also learned to communicate with both my colleagues and patients. With patients, at first, I found it difficult and would often forget to ask certain questions. Thus, I began conversing with as many women in antenatal clinics and postnatal wards as I could, creating safe and friendly environments in which I myself was more confident in discussing sensitive topics, and patients were comfortable enough to respond to me in kind. Overall, this obstetrics and neonatology clinical rotation has afforded me the opportunity to grow in so many different directions as a person, as a medical doctor in training, as a future healthcare provider, as a member of a team, a multidisciplinary team, and as a protector of those in my care. This was truly an eye opening experience, one in which I realized that there are many who require my assistance. I can make a difference, and in doing so, leave the world a better place. That's all, folks. Thanks for watching.